All right, name and title.
My name is Arzu Forough. I'm the founder and CEO of Washington Autism Alliance and Advocacy.
And could you spell your name for us, please?
Sure. It's Arzuforoughh.
And what got you involved in this line of work?
I have two adult sons with autism. We moved to Washington State in 2006, and we're very surprised that my husband's benefits through University of Washington as an employee of University of Washington didn't. Can we start that again?
Sure.
We moved to Washington in 2006. My husband took a job with University of Washington. We were very surprised that the benefits at University of Washington didn't cover University of Washington's Autism Center. We were very surprised that none of their benefits covered autism.
Where did you move here from?
From Texas, where we had insurance benefits. We also, at our local school, had access to something called an autism IEP supplement that provided parent training, in-home and community training. It was pretty robust, so I was very, very surprised when I got here as to the level of services provided through schools and through the insurance benefits.
And how has WA worked to change that?
Thank you for asking that. We initially focused on the education piece. We worked on teacher training and the autism IEP supplement. After that, we looked towards getting insurance benefits sorted out for public employees. Before 2010, there was only one major carrier. Before 2010, there was only. Can I start again?
Yeah.
So, thank you for asking. Before 2010, there was only one employer in the state of Washington that offered insurance coverage for autism benefits. So since 2010, we've negotiated coverage for autism benefits for public employees. We reached an agreement in 2011 for public employees for a type of treatment called applied behavior analysis. In 2011, we reached an agreement with the Medicaid administrator, the agency that administers Medicaid, to cover screening, diagnosis, and treatment of autism. Since 2012, we've been able to clarify mental health parity with most of the major insurance carriers in the state. We have also clarified the use of seclusion and restraint in schools for all students. There has to be a significant, I'm going to start that again, sorry.
And you can just start right there. There has to be a significant.
Right, there has to be imminent risk of harm to a student or staff before a student is secluded or restrained in public schools.
Has that been a challenge in public schools in Washington State?
Yes, we were very, very surprised by the number of cases in Washington State. The numbers were staggering before a law passed in 2015 that regulated this use. I can share that data with you later, but the numbers were absolutely staggering. We just got a data pool just this month, and we're looking at the school districts that are reporting. There's still a number of school districts that are not reporting as they ought to, but the numbers have gone down dramatically.
That's good to know. What are some of the biggest challenges? I don't want to ask that. What are some positive changes that you've witnessed in the last 5 years for families who have children with autism?
Thank you. That's a great question. Some of the positive changes is we now have over 45 centers of excellence for autism where families can seek diagnosis and referrals for treatment of autism.
So what's a center of excellence? Can you clarify that?
Sure. A center of excellence is either an individual provider or a group of providers that have training on how to screen and diagnose autism. They also know of the types of treatments, evidence-based treatments for autism, so they can make referrals for treatments that they think is medically necessary for each individual person that they are working with.
What do you believe the primary treatment is that's prescribed for autism by COE?
The one that is most commonly prescribed and the one that has the most empirical research and evidence behind it is called applied behavior analysis. It has about 6 decades of research and peer-reviewed data behind it.
Are these COEs for particular carriers or?
That's a great question. So in Washington State, when we reached that agreement with the Medicaid agency, this was a first step for families to get access to this type of treatment. Private insurance doesn't require this. It's only for families that have Medicaid. Can I add to that? Because private insurance doesn't require this, the experience is a little different. If I have private insurance, I can contact a developmental pediatrician, I can contact a psychologist. The amount of wait time for me is very, very different. The amount of travel for me is very different. Oftentimes I can get an appointment within weeks and see someone that can make an identification and make a referral for my child to access services. I can also access services much quicker. If I have, however, Medicaid, I have to go through a center of excellence. The entry to that center of excellence sometimes takes longer than what my experience is to private insurance. The wait time, if I have Medicaid, to start services can sometimes take up to 4 years. So my experience, if I have private insurance versus if I have Medicaid, that experience is very different.
Do you think that that is going to change, improve?
It's certainly my hope that that will change. It will take a lot of work. One of the things that we hope to see is universities in Eastern Washington, Central Washington, the more underserved areas of Washington, to start programs to train service providers. The other thing that I think would help is we need to incentivize providers to move to Washington. There has to be a reason why providers want to get into this profession.
And what profession is that? Who does provide applied behavior
analysis services?
The people, that's a great question. The people who provide this service are people who are nationally certified, called board certified behavior analysts. They are also licensed in the state of Washington as licensed behavior analysts. The training for it is very rigorous. It's similar to any other licensed profession.
What are some of the specific ways that Washington Washington Autism Alliance and Advocacy, what are some of the, oh, well, you get to say it over again anyway. What are some of the specific ways that WA helps families access coverage? What do you guys do?
Thank you. Some of the specific ways that Washington Autism Alliance and Advocacy can help families if insurance has either unreasonably capped or denied insurance benefits is we can meet with families and review their certificate of coverage and find out how their child is covered. We can help with appeal letters if the benefit is being capped or denied. If their child is struggling in school because they're not receiving services outside of school, we can also help navigate services in the community and help bring in a more whole.
Are these, you're just doing fine. Are these treatments that are now covered available to adults with autism?
That is a great question. In theory, yes. There is no age limit on mental health parity. However, there are few providers around the state that have experience working with adults. That makes the provider pool even smaller and smaller to work with adults. But there's no reason why we can't improve that capacity. There's no reason why we can't attract providers who work with adults to train others. So there's no limit on insurance coverage, but there is definitely a limit on provider pool, much more so than the provider pool for young children. Does that answer your question?
Yes, I'm thinking about families who have sought ABA treatment services for their adult children and have been denied. I'm wondering if you could comment on that.
Sure. So, depending on where they live, if they've been denied because they're trying to access services through DSHS, DDA, we can help determine how that adult is covered, whether that adult has access to private insurance, whether the adult has access to Medicare, Medicaid. Historically, most adults had tried accessing behavior supports and neurodevelopmental therapies through DDA. There was 5 years ago when we started having benefits through Medicaid, slowly CMS was under the impression that there was going to be a shift from DDA, DSHS over to DDA. I believe in August of this year, there was some guidance to DDA that all behavior support has to be covered through Medicaid. And so depending on why the family is experiencing that denial, we would be happy to help.
If you could have whatever you wished for the ASD community, what would it be?
Oh, that is a really great question. I think clear communication, collaboration, more acceptance for adults, more community for adults, more employment opportunities for adults. I want us as a state to really value that this is a community that has been untapped. They're growing, these are adults that are growing up and they live a long lifespan and they offer a lot of gifts to Washington State workforce, and oftentimes they are unemployed. So in an ideal world, I would like to see employment rate going from 80% unemployment to 80% employment someday.
Perfect, Arzu. How has your role as a mom impacted your work and focus?
I wanted to be June Cleaver as a mom. I had not envisioned being an advocate. That's how
Me either.
yeah. I'm a very shy, private person. I had never envisioned speaking in public. I had never envisioned bringing people together to make sweeping change. It's been a surreal experience, but then I've gotten to meet people like you, and that's been a life-changing experience for me.
What do you think, as far as accessing ABA treatment, what still needs to happen?
That's a wonderful question. The supply of qualified providers far outweighs the demand throughout the state. The other way around?
Yeah.
So
Yeah, go ahead.
the supply of,
Yeah.
the supply of, the demand for services far outweighs the supply of qualified providers throughout Washington State. This is especially problematic when you come outside of the major metropolitan areas. This is really, really difficult for low-income children and families.
And when you say providers, are you including physicians who can do diagnosis, as well as, say, the board-certified behavior analysts? Maybe other ancillary specialist providers?
This is most problematic for providers of applied behavior analysis throughout the state.
And how, you said earlier that you I'm sorry.
No, go ahead, sorry. No, that's...
No, I'm going to jump into that. You said earlier that you relocated here from Texas, and you saw some distinct differences at that time, and that was 12 years ago.
Yes.
What do you see, where do you see Washington now in comparison to other states?
So one of our team members did a search of provider rates for this particular category of provider across other states in the nation for BCBAs, and we are the lowest in the nation. That was really surprising to me. I can't remember if Texas was on the list, but I think that might explain why we're having such a hard time attracting providers from other states. We're having a hard time. Maybe we should be talking about rates. Yeah.
We can edit anything.
Yeah.
It's not live, so it's
yeah.
stuff you'll be able to look and see.
Yeah.
So probably what I would have asked for clarification is, are you saying that there's the lowest number of board certified?
No.
Okay.
No.
That's what it sounded like.
No, no, no. It's the rates that are the lowest.
The rates of.
For rates that we pay for providers is the lowest.
The reimbursement rate.
Yeah, the
Yeah, but
reimbursement
Medicaid
rates.
reimbursement's low, so.
Okay.
The reimbursement rates, but that's not what I wanted to talk about anyways.
Okay.
Okay, ask me the question again.
You started this work about 12 years ago, and at that time, you noticed a difference in service availability or
Yeah.
access to care in
So-
Washington State from Texas.
Right. So when I moved here from Texas, at the time, I looked up how many BCBAs there are in the state of Washington, and I think at the time we had 67 board certified behavior analysts throughout the state.
Oh, wow.
In contrast, we had over 1,000 in Texas. So Texaba, the state organization, was having meetings that was attracting people from other states. They were well organized. Fast forward 12 years later, now we have, I believe, over 550 board certified providers. So we've grown. We probably as a state need 3 times as many to meet the needs of the number of people who need these services. So we've done really well in growing, but we still can do better.
Do you want to say, talk about what?
Schools.
Yeah, schools.
Yeah, I do. I also would love for schools to be able to hire these providers. I'd love to see schools be able to fund these providers, and that's something. The behavior analysts. Schools have no way of hiring behavior analysts right now as not certificated, but
Licensed behavior analyst.
no,
Related
ESA.
service.
What's that category?
Certified
ESAs.
ESAs.
Yeah,
ESAs.
that's it.
Yep.
So you want to try that statement again?
Yeah. There's certified, paraprofessionals are classified, that's it. There's classified and certified. All right. So I would love for school districts to be able to hire behavior analysts as certified staff. Right now, school districts are not able to hire professional behavior analysts as certified staff. They can hire them as consultants, they can hire them as classified staff, and they're not able to pay them as the professional that they are. So I'd like for school districts to have access to funding and be able to hire these professionals.
Ask it. Yeah, go ahead.
So far.
Can you just talk a little bit more about applied behavior analysis and how that has actually impacted you and your sons, or what that might look like?
Sure, yeah. I have 2 sons that are very, very different. One of them is twice exceptional. That means that he has very, very high verbal intelligence, but struggled socially as a young child. He had a really hard time making sense of the social world. He had a really hard time with self-regulation. For him, applied behavior analysis was a way of getting along with peers, accessing social opportunities in group, social communication. He learned organization, organizing his thoughts, organizing his thoughts in writing, as well as organizing himself in the work setting, in classrooms, in larger community. His brother, my older son, had very little language. For him, applied behavior analysis was very different. He learned how to put sounds together. He learned how to make words. He learned how to make sentences. He learned how to make phrases. He learned.
That sounds like speech therapy. How's it different from
It's
speech therapy?
very, very different than speech therapy. We tried for years for our son to access speech therapy. Speech therapists were not able to get him to sit in a session and attend to them. Speech therapists were not able to get him to even come in a room with them. Speech therapists were not able to engage with our son at all. However, speech therapists were able to, through the help of a behavior analyst, were able to develop goals that then the behavior analysts were able to work on. It was a collaborative process between the speech therapists and the behavior analysts. It was very different. As an adult, our son is accessing the community safely. He is accessing public transportation safely. He is learning about social sexuality. He is learning about vocation and vocational training. University of Washington's vocational training program has behavior analysts running their program. So behavior analysis is at work in a lot of different fields. For my children, it's been very, very different. And I don't think they could have accessed their education and their community if it wasn't for applied behavior analysis.